Revising for the AKT, bear in mind areas of medicine that you may be less familiar with. One example is the area of shared care prescribing. Now, shared care prescribing is done for a number of different drug groups: rheumatological drugs such as methotrexate and leflunomide, cardiology drugs such as amiodarone, and drugs used in psychiatry. These are the dementia drugs or methylphenidate, to give a few examples. Methotrexate is perhaps one of the most common shared care drugs, so you ought to familiarise yourself with this, and you may not be actively involved with this in your practice, so make sure that you check with somebody beforehand so that you're knowledgeable. Now, patients who are having methotrexate need to have regular blood monitoring. This is because of bone marrow suppression. They can have pulmonary toxicity and hepatic problems, so we monitor liver function tests and full blood count regularly. The important points with methotrexate prescribing are that, first of all, it's weekly dosing. You ought to dose in 2.5 milligram tablets. Now, the reason for this is that tablets come in different strengths, and patients often get used to taking, for example, 6 tablets a week or 8 tablets a week. If you suddenly change the strength of tablet from a 2.5, then patients can mix up their doses and get a lot more than you intended, and this is a common area of error. You should also prescribe folic acid to patients. And from the point of view of bone marrow suppression, warn patients about sore throats, fevers, ulcers, that sort of thing. Amiodarone is another shared care drug. You should bear in mind that patients need pre-dosing bloods and ECG, and they should get regular testing then of their liver function test and thyroid function, usually around 6 months. Inform patients of the possibility of corneal microdeposits, so they should get regular eye tests with the optician. And there are a few important interactions with amiodarone that you should be aware of because you may be tested in the exam setting. So I'm going to give you 3 interactions with amiodarone. The first relates to hepatitis C medication, which can cause bradycardias and heart block. You should beware drugs that prolong the QT interval, citalopram and escitalopram, for example, with amiodarone. That's not a combination you want to use. And it's not just medication taken orally. Eye drops can also cause problems, and a good example are beta blocker eye drops. You shouldn't use those with amiodarone. Shared care protocols are really important, so make sure that you're familiar with it. If you're not, then ask your trainer or one of the GPs working at your practice, because you may be tested on it in the exam.